Alright guys, we're going to finish up our cold modality discussion today. So again, a little bit of a refresher. Cold is generally safe to use in any phase of healing. Okay, we kind of always have that in our corner. The main reason why we use cold is going to be that it decreases our cellular metabolism. Remember, I like to use the word cellular activity instead, okay, just how active our cells are. And when we are reducing our cellular metabolism, we're also reducing the amount of oxygen that those cells need. Everything just kind of slows down. Think about when we are experiencing hypothermia and we learn that your heart rate decreases, that your breathing rate decreases. Everything kind of goes into hibernation mode. Okay. A study did a fact that a 20-minute crushed ice pack treatment, okay, caused a decrease in cell metabolism by 19%. And that's pretty substantial when we think about the amount of activity in our cells. So we kind of use that as a good rule of thumb. So with any cold modality, we experience what we consider the C-band method, okay? And the C-band method is basically just a roadmap for the sensations that occur when you're experiencing these cold modalities. And this goes from anything from feeling it in a local reaction or to feeling it all the way into the systemic. So as soon as you start the cold modality, it's going to be cold feeling. We don't have hot ice, okay? Then patients describe a burning sensation, and that burning sensation has to do with those nerves that are being affected. As the treatment continues, you start to develop an aching feeling, and then finally it is numb, okay, where those nerve impulses are no longer receiving that signal. A lot of people, I feel like to switch around this B and the A. I'm very interested to seeing what you guys personally experience when you do your lab assignments. Now we're going to discuss some of the modalities that we have in the athletic training room. The first one that we're going to discuss is a cold whirlpool. Okay, I know you guys have already experienced the warm whirlpool. This one will probably be a whole lot less enjoyable. So our first cold modality is going to be talking about the cold whirlpool. And I know you guys have already experienced the warm one, so you're already going to know the procedures. The cold whirlpool needs to be set at a temperature 50 to 60 degrees. Now there's going to be some things that play a role in whether you're closer to 50 or closer to 60. Some things to kind of keep in mind when you're considering what temperature you have to have the whirlpool set in. The more people you have in the whirlpool, the colder your temperature can be. Also, the amount of body area that is in there. The more body, the warmer it has to be. Things to keep in mind when you're doing the cold whirlpool. You have to watch for patients that have open wounds, just for the germs. If they do have an open wound, they do need to be in the whirlpool by themselves. You also have to worry about people that have circulation problems, whether that is dealing with a cold whirlpool or dealing with the warmth. The next modality that we see a lot is the Game Ready. Okay, and Game Ready is definitely just the brand name, but there are several different machines out there that apply the cold water as well as the compression. But the ones that we have in our actual athletic training room are Game Readies. The good thing about Game Ready is they are good for acute and chronic injuries, so you do have a wide range of time when you get to use those. You also have the ability to adjust the temperature and the pressure. Keep in mind that if you're dealing with a more acute injury, the higher the pressure is really going to be more uncomfortable for that patient. One of the unique things about a Game Ready is that you have to have the specific sleeves for each specific body part. So if you have a knee injured and you only have the ankles, it's not going to work. One of the luxuries of having a Game Ready is that it comes with a portable battery pack, so you don't always have to be limited to the use in the athletic training room. However, they are very expensive, so we are lucky to have them, but not every school is going to be able to afford them. Modality is going to be the ice cup. One of the good things about the ice cup is that it's very good to not only apply the cold treatment, but also give the massaging effect that is beneficial to many injuries. The more pressure that you can apply, the better your treatment's going to be. It's going to get that cold temperature down to further levels into the tissue. However, unless you have a very large ice block, you're not going to be able to use it in a very big area. They do make those blocks, but they're not really seen a lot in the athletic training room. So you can click on this video and watch how to properly use the ice cup treatment. The next one that we see is a slush bucket, which is basically a whirlpool without the motor. Okay. The same contraindications and indications for the whirlpool are going to apply for the slush bucket. Usually, though, you're dealing with more just at the distal extremities, dealing with our foot, our ankle, our hand. You don't really see the whole slush bucket for the whole body unless you just choose not to turn the motor on for your whirlpool. Okay, but you're going to have that same indications. The last one is going to be the gel pad. We hardly ever use these, but they are good because they're reusable. We always like things that we can pay for once and use several times. However, they can be dangerous because they live in the freezer. You can actually get them to be so cold that they actually cause the tissue to freeze and die. So we try not to use these very often. Actually, I don't even think there are any in our freezer at Maine. But we do need to know what these are used for. They're just like the ice bag. They're just reusable. So those are our modalities. We will start doing our labs today and continue through next week.